Kidney transplant is one of the very safe procedures. It's from the patient's perspective. If you look at it, he has to go through surgery, but it's not a very great surgery in terms of surgical skills. It's a great surgery in terms of immunological process management, for which we have wonderful drugs nowadays to take care of immunological challenges which they come in, and we've got a nephrological force in the country which is very competent to take care of these kind of issues as and when they come with the patient. In India, most of our program is live donor program, and the donors have to come from the family of the patient or the person who is sick from or suffering from kidney diseases. I must like to put it to the family members that it's a very safe surgery. Donors are screened through and through for their safety profile before transplant, during surgery, and generally most of the tests are able to give us fair amount of an idea for the rest of their life whether they will ever suffer from any kidney disease. So the safety of the donor is also taken in account to the highest level of standards so that they do not suffer. The delivery of treatment about transplant, that still is one of the very finest quality of once you get a transplant for your kidney failure, the quality of life which one achieves is almost as good as normal. But then you have to follow certain set of changes in your life which is little away from the normal, but more or less about majority of your life is almost like normal life. Then India, being a tropical country, we have a huge burden of infectious diseases. They become an important cause as a result of various infections or the treatment of infections. We get kidney disorders, what we call it post-infectious kidney diseases, which over a period of time can progress to a requirement of dialysis or a transplant also. The diseases which has really given this kind of a rise in numbers include the diabetes, blood pressure, mainly because of the lifestyle changes. Then of course there are some genetic disorders. We are living, particularly northern part of the country, is a stone belt, a lot of obstructive uropathy, stone disorders which can lead to the kidney failure. Then many times children are born with some kind of congenital defects which immediately or in the later life can lead to kidney disorders. You need to follow a few norms standard. First thing, you should keep yourself well hydrated. You should drink water as per your thirst, but minimal, at least 2.5 liters of water drinking. Liquid intake should be maintained throughout the life, provided you do not have specific issues or your doctors have not constrained you for that fact, that first part. Apart from that, avoid unnecessary medications, particularly the painkillers which can injure your kidneys. Particularly if we have any risk factors, like if you have a family member who's suffering from kidney disease, if you have diabetes, or if you have blood pressure, or you've got a stone disease, you need to have some kind of a protocolized health check time and again repeatedly so that the disease does not progress to a level that you need a support system around it.